There's a crucial molecule in your body that helps control everything: your circulation, your energy, your stamina, your heart, even your sharpness of mind. It's called nitric oxide. But after age 40, your body makes less and less of it. Less blood flow, less stamina, less of you. But now there's N101, the nitric oxide lozenge developed by Dr. Nathan Bryan, the world's leading nitric oxide researcher backed by Nobel Prize-winning science. N101 is designed to naturally restore your body's nitric oxide levels. Just do what I do and let one dissolve in your mouth twice a day. I especially make sure to take it before workouts. N101 goes to work in minutes, releasing nitric oxide directly into your bloodstream, supporting healthy circulation, boosting oxygen delivery to your muscles and brain, helping you feel the way you're supposed to feel. More energy, better blood flow, sharper focus. Day after day. N101, it's the science of you working better. Visit HoffmanNO.com. That's HoffmanNO.com and use coupon code Hoffman10 for 10% off N101. Welcome to today's Intelligent Medicine Podcast. I'm your host, Dr. Ronald Hoffman. Today we're going to talk about kids' health, in particular, kids in relationship to COVID. I'm privileged to have as a guest today Dr. Elizabeth Mumper. She's an MD and author of a great book entitled Kids and COVID: Costly Mistakes That Must Never Happen Again. Dr. Mumper has practiced pediatrics for 44 years. She's a veteran in the field, and she has a special interest in children with neurodevelopmental problems and complex illnesses. And as a medical detective, she's delved into the details of children's histories to discover the root causes of their problems, not merely to put a Band-Aid on them. And she has also had experience directing pediatric education for doctors in residency. She's served as medical director for the Autism Research Institute, ARI, and has also helped to teach clinicians in 21 countries and around the U.S. And as COVID emerged, she watched with horror as many pandemic management decisions from so-called experts in government, in her opinion, and I heartily agree, had severe adverse effects on the well-being of children and adolescents. And that forms the basis of the book, Kids and COVID: Costly Mistakes That Must Never Happen Again. So without further ado, here's today's guest, Dr. Elizabeth Mumper. Thanks very much for joining us today.
Thank you, Ron. I really appreciate the opportunity to be on your podcast.
Well, indeed. And so in your book, and I'm going right according to the table of contents in your book, you kind of have to establish your bona fides when it, because you're taking on the medical establishment. The medical establishment has said that the vaccines are perfectly safe. They've actually mandated that vaccines be administered to children as young as 6 months. And so your book has a section which is appropriately titled, Why Should You Believe Me? And why should people, what is the basis for you taking what's kind of an outlier position as a pediatrician?
Well, I really wanted to write this book from a perspective of getting parents to ask a bunch of questions and come to their own conclusions. And my underlying theme was that parents shouldn't just blindly trust the authorities. Early in the pandemic, very, very early, it seemed so strange to me that we weren't looking at repurposed drugs. There was this push to wait for the cavalry to come, which in this case was a totally new type of, they called it a vaccine, but I called it a gene manipulation product, basically. And that was so unusual. The other thing that I thought was so strange from the very beginning was that the same rescue was going to be applied to everybody, not determining individual risk.
One
And
size fits
I
all, in
knew,
other words.
yeah, one size fits all should not be on the table for medicine in the new millennia. You know, in functional medicine and integrative medicine and in research, we're trying to get to more and more and more specificity and dealing with individual problems rather than applying just a one size fits all strategy. And it became clear very early on that children were really not at risk particularly for having bad outcomes from this disease. We know as pediatricians that many children have had coronaviruses, not necessarily this strain, but many normal cold viruses are coronaviruses, as well as rhinoviruses and adenoviruses and some others. So we also know that children tend to have very, very good innate immune systems. That is the type of immune system that comes out very early in an infection, tries to protect the child or the person, and that serves them well when fighting viruses. So, very early on, I thought this was not going to be good for children. And when they announced the initial, 2 weeks to flatten the curve lockdown, I thought, well, that's not going to be particularly harmful. Kids will view it as a bit of a vacation. Maybe they'll have some fun time with their parents that they wouldn't otherwise get to have. But as time went on, it became clear that it was really hurting them in so many ways. So I was looking at this from the perspective of a practicing pediatrician. And many people that made these decisions had not taken care of children since they were medical students or residents, perhaps. And my 44 years of experience, I think, gave me a unique perspective. I've also been heavily involved in medical education, as you mentioned. And so not only do I try to teach my parents, but I've been very lucky in that I've gotten to teach doctors and interns and residents along the way. And so, a big part of my identity as a physician is that I need to learn stuff well enough to be able to teach it. And early on in the pandemic, the Great Barrington Declaration came out. I was an early signer. That made so much sense to me because those
Let's talk a
folks
little bit about
were,
what that precisely is, because
yeah,
this is actually something that got enormous pushback. And in fact, one of the
yes.
co-authors of the Great Barring Declaration, Jay Bhattacharya, happens to now head up the CDC, Centers for Disease Control. So there's been kind of a real turnaround because the very guy who expressed skepticism about our COVID strategy is now instrumental in formulating our health policy. But so let's go back in time to that moment of the Great Barrington Declaration, which, by the way, I also signed on to, but it was very controversial, and they actually sought to suppress it, and even on social media, they did not want to even get the word out about it.
Yeah, it was a great tragedy because those three authors were eminently qualified in epidemiology. You mentioned Jay Bhattacharya. He's got four different advanced degrees. It's amazing. And the other two people that signed on, one is an eminent professor at Oxford who's also an accomplished researcher and author, and the other is at Harvard and or MIT as an excellent epidemiologist. And they recommended the traditional public health approach, which was to identify your high risk patients and protect them, but to allow people who are healthy to essentially get the virus and develop immunity in the community. And as viruses go through a population, they often eventually become much less deadly. From a sort of a theoretical standpoint, the idea is that the virus can't kill off all its hosts, or it too will cease to exist. And so, by having young, healthy people who weren't really at risk to die to actually contract this virus, the idea was that you would get a level of immunity in the community. You wouldn't have to shut down economies. You wouldn't have to take young kids out of school. And you would save the elderly. The mortality and morbidity really increased after the age of 65. And it honestly didn't get really bad until after the age of 80. And that is not at all what most people on the street were led to believe.
Along with what
Um,
are called cofactors that were
exactly.
thought to be risk factors for more serious outcomes. Because, you could, as you well know, we're approximately the same generation. There are 75-year-olds and there are 75-year-olds.
Right. So anything like diabetes or underlying heart disease or bad hypertension, or, even for children, if they had immune deficiencies, we would worry more about those children. And early on the pandemic, we knew that the people that died um, typically had at least two and a half of these comorbidities. They also usually had a vitamin D level under 50, and they just were not in as good overall health, and they didn't have the metabolic reserve to deal with this virus. And so from the very beginning, I was wondering, well, why aren't we working on people's vitamin C levels, which is a great antiviral and a great antioxidant? Why aren't we telling people to get their vitamin Ds up? Because that's a great anti-inflammatory intervention. And why aren't we using these repurposed medicines that many physicians around the world were having good luck with?
And there was,
So,
namely, hydroxychloroquine, and then later ivermectin. What role did you see for these so-called repurposed medications? Why should they be
well,
beneficial? And at the very least, as stopgap measures until we had more definitive therapies, because there was a long gap where we had nothing. And anytime you mentioned anything that was plausible, it was thought to be heretical. I actually wrote an article early on in COVID about the use of vitamins, the vitamins that you mentioned, and other things. And I was slapped with a complaint from the Federal Trade Commission, and had to hire a lawyer and defend myself because I merely enunciated the view that perhaps we should support the immune system of people.
well, clearly what you experienced is not the way that science should be done. We should welcome people with innovative ideas, especially when we're talking about cheap already existing medications that have a good track record. So the two that you mentioned, hydroxychloroquine, has a great safety record. It's one of the few drugs that's very widely used in pregnancy. We usually have a very high threshold for safety and efficacy when we're giving it to pregnant women, which means you're actually giving it to two patients. And then ivermectin had such an incredible track record in a study that there were like 98 studies, and something like 15 or 18 were randomized and controlled, uh, getting in the neighborhood of 136,000 patients and in 20 countries from around the world, showing that there was significant decrease in mortality, in the death rate for people that took ivermectin. So I thought it was not only nonsensical, all this pushback on ivermectin, but I think it was also unethical
But the
because
government called it
um,
horse paste. They said, don't use horse
I
paste.
know.
You're not a horse. There was literally a campaign to ridicule patients and doctors who thought to access this, perhaps not a panacea, but somewhat of a plausible ameliorating therapy. Again, not a slam dunk, but something that might moderate symptoms, shorten the course and severity of the disease.
Of course, Ron. And in my anecdotal experience, many people who took ivermectin got better within 12 to 24 to 48 hours. And that was not the typical course that people were being afraid of. Now, I did in my city have trouble getting ivermectin.
Me too.
You know, being the educator that I am, I thought, well, oh, the pharmacists just don't know about this. I'll pull together, some good articles about all this morbidity and mortality data. And surely once they see that, they will fill my prescriptions. And so I was going around handing those papers through the little drive in windows at the drugstores, and it didn't really change anything. There were only two pharmacies in town that were both independent, not big chains, that would fill my ivermectin prescriptions. And, that was a big change because usually in the past, pharmacists would question me to make sure I had calculated the dose correctly or double check on, how long I really wanted to have the patient take the medicine and, or, how many refills. But they don't typically call you to say, I, the pharmacist, am not filling your prescription because the government sent out this meme and they
Yeah.
would say, well, the government sent out this thing saying people shouldn't take ivermectin because it's used for horses. And that terrified me because um, I just perceived that somehow the fear that was being, I think, mobilized against us. Ron, you and I know that when you're afraid, you're working out of what's called the limbic system or your kind of primitive reptile brain, where you're just concerned about fight or flight and survival. And you can't really do the critical thinking that happens in your frontal cortex that allows you to make good decisions. So I think the government just basically really manipulated the population to be afraid. I think that there was manipulation to make people desperate for this new technology. I think COVID turned out to be kind of an opportunity to unleash this mRNA technology, which was, used very minimally previously in certain situations with cancer. But I know for a fact, having attended some of the pharmaceutical conferences, that it's perceived as this fantastic new technology because with any given virus, they were hoping to be able to roll out
Hmm.
mRNA vaccines within 100 days.
It's a quick
If we
turnaround
can,
technique. It's
yeah,
just basically you can do like map the virus and then quickly create a template and then churn out the instructions for the body to make certain parts of the virus. But the question is it a sound technology? Is it ready for prime time? Certainly, COVID provided the impetus. With you say, we're making decisions based on our limbic system, snap judgments. We had Operation Warp Speed because there was, people were dying. Literally, there were refrigerator trucks piled up in front of, storing bodies in front of nursing homes here in New York. There was a real frenzy about this, and then we got the vaccine to deliver us.
well, a lot of concerns that I had about this technology have sadly come true. And I will report to your audience that when I was at these pharmaceutical meetings, they were bemoaning the fact that there were regulatory hurdles in the way that they would have to get through in order to get this technology out. So, as you point out, it was all about warp speed. And I think that a lot of the safety information was not carefully collected, carefully analyzed. And as a result, this particular gene product has had more bad side effects, and some of them actually devastating side effects, than other vaccines combined for the last 40 years or so.
Certainly, I've
So,
seen that.
in
And
my,
I have to say that in my relatively limited clinical practice, because I'm not a hospital based physician, I didn't see, volumes of 35, 40 patients a day. But I saw a fairly substantial flow of patients that it was remarkable the degree to which I saw side effects from this vaccine. I'd never seen that before. I'd never seen that with the shingles vaccine, although there have been side effects. I've never seen that with, ordinary vaccines, MMR, et cetera. I mean, we know there's side effects associated with every vaccine. That's a part of the risk-benefit equation. But I never
I,
saw such a volume of concerning and sometimes bizarre side effects associated with the COVID vaccine. It was even, I could see that, as a community doctor.
well, I agree with you. And, I've probably, you as an internist wouldn't have given as many vaccines as I, as a pediatrician, would. But I was concerned that bad side effects weren't being reported. One of my former nurses or actually a nurse practitioner, took the COVID vaccine and was really disabled for several days with dropping blood pressure. And when I called the hospital to say I really thought they should report it, and told them about, the VAERS report and how, it was a duty to report, their response was, well, she didn't have an immediate first 15-minute anaphylactic reaction.
Okay. So no,
And
the
so,
classic reaction. Yeah.
yes. So I think that a lot of people had reactions that weren't ever reported to VAERS, but even the ones that were reported to VAERS were on a scale we have never, ever, ever seen before. So I totally agree with you. And unfortunately, one of the things, as you know, that happened with the Pfizer trials, for example, um, after the vaccine came out and it was offered to the first, set of volunteers, then the people who didn't get the vaccine, who were chosen to be the controls, were offered to be able to get the vaccine too. And because they were fearful of this disease because of everything on the news, they 96 or 98% of them decided to take it. So, Ron, what happened with that is that it effectively wiped out a control group for any kind of long-term side effects.
That's a really good point, because what you want to see how you want to have pure groups. You want to see the control group that is indeed a virgin when it comes to vaccine, compared as a comparator to people who receive the vaccine. And you want to observe them for, not just a few weeks or months, but perhaps even for years, long-term
Yeah,
outcomes.
5 or 10 years is what I would like to see. And, frankly, I don't worry as much about a sore arm or a transient fever. I think the really concerning side effects are, for example, some of the devastating neurologic side effects
Hmm.
where people describe the small fiber neuropathy, where it feels like there's a cell phone vibrating inside their body, or they've got numbness and tingling on their limbs, or the people that have what I believe is a significant mitochondrial dysregulation as a result of the
Hmm.
COVID shots, and have, such extreme fatigue that former CEOs who worked out for an hour in the morning and had 12-hour days and traveled a lot, all of a sudden, couldn't get out of bed. So long-term side effects, I think, were really downplayed and not well studied with this. And now we have many thousands of people who have been disabled by the vaccine.
Okay, folks, at this point, let's pause and allow one of our sponsors an opportunity to share an important message with you. So here goes. Listen up.
Has your digestive health been striking out due to poor food choices, medications, stress, and other lifestyle issues? This season, hit a home run for your digestive health with Dr. Ohhira's Probiotics. Dr. Ohhira's Probiotics is a live probiotic encapsulated in small, easy-to-swallow capsules that delivers Dr. Ohhira's signature blend of pre, pro, and postbiotics. Dr. Ohhira's award-winning formula contains a prebiotic blend of fruits and vegetables, which are naturally fermented with 13 strains of live probiotic bacteria for a minimum of 3 years. The result? Dr. Ohhira's game-changing postbiotic metabolites, which are key to supporting long-term digestive, immune, and cognitive function. Dr. Ohhira's Probiotics, an all-star formulation and the best probiotic on the market today for overall digestive health and wellness. Dr. Ohhira's Probiotics, available at Sprouts, Natural Grocers, and other natural health retailers nationwide.
Thanks for listening, and thanks for supporting our sponsors, because they are what make Intelligent Medicine a continuing free resource to you. And now back to today's guest, Dr. Elizabeth Mumper, author of Kids and COVID. Is there something inherently different and suspect about the mRNA technology that may make it more likely to produce adverse reactions or long-term side effects?
Yeah, I think definitely so. So a classic vaccine usually either gives you a small amount of an attenuated or changed to be less virulent virus, or perhaps a killed version of a certain bacterial germ. And then your body makes classic antibodies to it. And so there's a measurable amount of the foreign substance that's being injected into you. The
It
concern
kind
I
of goes
have,
back to
one of
the
the many,
original, like the Jenner vaccine, with the cowpox under
yes,
the skin. it's kind of a facsimile of nature, somewhat attenuated. It elicits an immune reaction.
But for the mRNA vaccines, what they were essentially doing was telling your body to make spike protein. And spike protein was one of the things that was, very dangerous to people. It tended to be associated with a lot of endothelial dysfunction and cause a lot of pro-inflammatory side effects. And as a pediatrician, I sometimes think in fairy tales, and I talk in the book about the Goldilocks factor. We didn't know with this particular injection, was it going to be too hot, meaning that people are going to make too much of the spike protein and it was going to persist in their body. And now we know that some people have continued to make it for years at this point. Was it going to be so hot that it would cause a lot of pro-inflammatory side effects? Or was it going to be too cold where it wouldn't elicit a sufficient response? It wouldn't make enough spike protein to have the body recognize it and have the immune system respond to it. So even though there are so many people that think it's such a fantastic technology because it can be rolled out quickly, I think that you cannot sacrifice safety and long-term disability or death numbers just because you want to get something quickly in 100 days with less regulatory oversight.
So the claim is that the mRNA, which is instruction for the body to manufacture spike protein, to use the body's machinery to make the spike protein, which is the calling card of the COVID virus, and that as a result of making the spike protein, the body would recognize the spike protein and create antibodies to it to elicit an immune response. But is it possible that for some people, by virtue of how it was injected, maybe it got into the systemic circulation, and it took up residence in other parts of the body and created instructions for spike protein to be made in the brain, the heart, the muscles, elsewhere remotely from where the injection was?
Oh, for sure. I never understood the whole, it's going to stay in your arm thing. I mean, anybody that's been to medical school knows that, the human body is a network of these incredibly overlapping systems. Your endocrine system talks to your neurologic system, your cardiovascular stability and heart rate variability has an overall effect on, your health. So the idea that this would be a local injection made no sense to me because you have capillaries and veins and arteries, in your arm. In fact, it took a FOIA, a Freedom of Information request, to get a study that was done on the biodistribution after the mRNA injections of something called lipid nanoparticles. And it was shown that they go to multiple places in the body. And one of the most concerning things to me as a pediatrician was the data that these lipid nanoparticles go to the ovaries. And at the time they cut off the study, the amount was continuing to increase in the ovaries. So we don't even know the final leveling off point. And pediatricians are aware that a baby girl, when she's born, has all the eggs that she's going to ever have. And so the idea that this was cheerfully, rolled out to pregnant women, even though people in the Pfizer study were told not to get pregnant. And in fact, the people in the study were kind of the Avengers among us. They were, very, very healthy people. They deliberately excluded people that had all the comorbidities that were the issue.
So in effect, we're testing best case scenario. We're testing a virus that's designed for administration to all and sundry on the very healthiest subjects that we'd have, with exclusion criteria for people with comorbidities, which is the very population that we want to protect. Boy, that's just incredible. All right, we've laid the groundwork for our discussion in part two. I want to talk a little bit more specifically about kids, because we've been talking a little bit in generalities about some of the downsides and risks associated with the vaccine program and the way we handled COVID. but you as a pediatrician, you have a special viewpoint on how we handled the pandemic when it comes to kids, and we'll focus on that in part 2. Our guest is Elizabeth Mupper. She is the author of a great book, which is entitled I'm looking at my information page here. Give me the title once again, the full title.
Kids in COVID, Costly Mistakes That Must Never Happen Again.
Okay, and it's available through the usual sources, but is there a specific website where you have more information about the book?
Well, actually, it was published by Skyhorse in conjunction with Children's Health Defense. One of the reasons that I chose that publisher is that some of the proceeds support the work of Children's Health Defense, which, if your listeners don't know about them, they are very much advocates for healthy children, especially trying to decrease environmental contaminants and toxicities that are affecting this generation of children. And so they have a lot of lawsuits against polluters, for example. They advocate for parental education about healthy things for kids and things that kids should avoid, even things like screen time. Glyphosate is another great example, which is a fertilizer used in Roundup. And so I wanted Children's Health Defense to benefit. So Amazon.com or BarnesandNoble.com are really the best places to get it.
Great stuff. All right. When we return, more on the subject of COVID and kids. I'm Dr. Ronald Hoffman, and this is the Intelligent Medicine Podcast.